Doctors' offices and hospitals are packed as cold and flu season hits its peak. Nurses, who are often the first to treat us when we're sick, are really struggling to keep up right now.
Tonight, a group of them claim they're not getting paid during one of the busiest times of the year, and they are asking D.C.'s Attorney General to investigate MedStar Washington Hospital.
Now, Randy Hildreth met with a nurse who told her this is a bigger issue than patients realize.
That's a big reason nurses want the AG to step in and pore over hospital pay records. And there was a sense of frustration when I spoke with one nurse tonight. She says hospitals' nursing staff are very busy right now dealing with a surge with flu cases, so they want to make sure that every cent is on their paychecks. Nurse Julia Truelove says it's simple.
You deserve to be paid for every minute you are at work.
But Truelove says that's not always the case for nurses at MedStar Washington Hospital. In a new complaint filed Monday with the Office of the Attorney General, National Nurses United, their union, claimed the hospital changed pay records to add lunch breaks for ER nurses even when they couldn't take them. They claim operating room nurses have been paid late and allege a work culture where staff are encouraged to come early or stay late without clocking overtime pay.
If you miss a meal break, you deserve to be paid for that time you were working. And so for nurses to have their time cards modified after the fact without their knowledge means your employer is sticking their hand in your pocket.
Union leaders say an ER nurse first flagged the meal break pay concern. They estimate about 80 other nurses may have similar issues. About 50 operating room nurses may have dealt with late checks, and over 800 nurses have overtime work concerns. WUSA 9 reached out to MedStar about the complaint. A hospital spokesperson confirmed it was aware of some concerns regarding pay, and in a statement said in part, quote, "We immediately began looking into those concerns, and where we have confirmed a mistake, we have issued corrected paychecks to impacted nurses. We are continuing our review and will expedite correction of any errors we identify." The union complaint notes these issues may date back a few months to over a year. Truelove says the union wants details from the hospital about the full scope of the issue.
It's not your job to make sure you're paid fairly, it's your boss's job. Your boss is in charge. That's why we've filed with the DC Office of the Attorney General, because this is an issue with our employer.
The nurses do plan to protest tomorrow outside of the hospital at 9 o'clock to continue to express their concerns. I did reach out to the AG's office. They say they don't typically comment on complaints, but they do encourage anyone who feels like they are dealing with workplace issues to contact their office. Reporting tonight, Randy Hildreth, WUSA 9.